Hi, I'm Dr. McGinnis here at Island Eye Care, and I'm here today to talk to you about a new treatment for dry macular degeneration. So yes, you heard me right. There's now a Health Canada approved treatment for macular degeneration, and we're proud to be the first ones in Cape Breton to offer this to our patients. Previously with this disease, we'd have to make some lifestyle modifications or look at some vitamins in the hopes we could slow down the disease. Now we have an active treatment with Macumira that we're able to actively treat macular degeneration and improve our outcomes. So we'll show you how it works in just a moment. The way it does happen is there's a little microstimulation that goes from the front of the eye to the back of the eye to stimulate the cells. It takes 32 minutes. It's painless. We do 4 treatments in the first 10 days as a loading phase, and then we'll treat every 3 months to keep our gains. So Morgan's going to give us a hand here and show us how it works. So that's why I'm wearing this surgical cap. We need one on before we do the treatment. I'll have my glasses off, and then Morgan will set it up from here. And so we'll have a headset that goes on, and it looks kind of funny getting all set up. And then you'll see the little metal eye cups that are going to come around here in just a moment. So we'll get it all tightened up, and then we'll adjust it down for these metal cups, and they're just going to come in contact with the eyelids. And so that's where the microcurrent passes through. So still pretty painless on everything. Just a little bit of pressure on the eyelids. So we'll be all set up. We got him on camera now, so he's really feeling the stress of everything. So we're all lined up. Usually patients are not talking through all this too. And so it'll be 32 minutes like this. So there is one other grounding electrode that's placed on the temple. As far as any side effects or feelings, occasionally there can be a little tingle right where we put this grounding pad on. And so this is what setup looks like. We're here for 32 minutes. I dare you to try to stay awake for the full 32, but we have a nice pillow if you do decide to fall asleep. And so this is what things would look like. So after your 32 minutes, once this is all set up just like this, then we would say we wait for 32 minutes. When we're done, we can then undo all of Morgan's great work that he just did for us. But I can say I can model what it looks like. So now we'll kind of take it off. Morgan's really questioning his decisions to help out today about losing all his great work. And so that's what's involved. So like I said, we do 4 treatments in the first 10 days, and then once every 3 months afterwards. If this sounds like something you'd be interested in, by all means, feel free to contact the office. If you're not a patient here, you can speak with your eye care provider, and they can send a referral to us as well. So we're super excited for this piece of equipment. We've treated multiple people so far, from mild and moderate macular degeneration up to severe, from trying to improve reading speeds for some patients, to one patient who actually had some issues with some hearing aids. And so she had lost her vision to the point where she wasn't able to tell the difference between the lights for left and right, or to be able to charge the hearing aids. After the first treatment, she could now see the lights, and she could now put her hearing aids in herself and charge them herself. So it's a powerful piece of equipment. We're pretty excited about it. So feel free to give us a call and come to Island Eye Care and see the difference.